Hello, my name's Evan Collins, and what we're here doing today is looking at some of the plates and screws that go into fixing fractures, whether they're your hand, your wrist, or your elbow. Because oftentimes I find that when patients I start describing exactly what's going to be used to fix the fracture, to get a reference on the size and the shape of what we do is really what we're here. So I thought I'd just open the trays up. Let's look at the different sizes of the screws for both fixing finger fractures, for fixing wrists, and for fixing elbows. What we're going to do is I'm going to show you the plates and screws for each different part of the body, starting with the fingers in the hand and going up to the elbow. If you look here, what I'm going to show you first is when you have a break in this area of your hand or this part of your finger, the size of the plates and screws that are usually used. If you follow down, you can see these are the types of plates and screws in terms of the size. Now you see they sit, there are several of them in each little area, and they're all shaped differently, and what creates the determination, or what creates the, let's say determination, but what creates the choice between one plate and the other is the type of fracture. The configuration of the fracture dictates which plate best fits that fracture pattern to fix it. If you look at, here would be the size of the fracture, you can get a sense of how that plate may fit onto your finger. And then here's the screw holes that go on. You're talking about 2.3 millimeters. So if you look at it reference-wise, it's certainly a lot smaller than a penny. Now we're going to look, we've looked at the plates and screws that go in the fingers, and now we're going to look at the wrist. This is one of the sets. There are several out there on the market, but this happens to be one that we use. And this set is, what wrist plate. It's an anatomic plate that goes on the volar or the palm side of your wrist, and that's about the size of it. That's one type or variety. And then if you look at it, we have different plates that are contoured or shaped differently. This is more of a shape that follows the natural contour of your wrist, which would be something like this. Again, if you look at it, it's fairly thin. It's certainly not a very thick plate. And you can see all the little holes in here that are designed to take the screw as it gets fixed to the bone. So again, just referencing this, if you look at the length of this, here's the plate that we're going to use, and here's a large paper clip. So in terms of the length of it, it certainly seems a lot bigger when you look at it on an x-ray, but then when you start seeing it relative to other things we commonly use, it gives a context. It gives it in terms of a focus of just how fine some of these materials are when we fix wrist fractures. Well, now we're going to talk about the elbow, and one of the first things you notice in the tray here in the set that we tend to use more frequently is that there's different colors. Well, the colors correspond to the different sides of the elbow, so that way we keep things consistent. The inside or the medial side of the elbow uses one color, and the outside or the lateral side of the elbow uses another. So that's one of the things, but we're here to talk about the relative size, and if you look at it, this would be, again, one of the size plates that goes on the inside of your elbow. So here's the plate, this is how long it is, and this would be sitting in some ways right on the inside of your elbow. So it gives you an idea of just how thin or small this is. And this is the shape, so it's nice conical in nature so that it fits on the bone, because the bone tends to become a little bit more pointy in this area. And these are all bent before we use it. We don't bend them in the operating room. They come pre-bent so that it's easier for us to put it on the fractured fragments. The difference in the elbow plate than some of the others is the variety of plate choices, and that's usually because there's a variety of different fracture fragments that happen more frequently in the elbow. So therefore you have plates that unfortunately that could last pretty much the whole length of the arm depending on where your fracture is. And this would be a lateral plate, and that would sit pretty much from here to here and give you an idea depending on the extent of the fracture. So although it looks very long, you can see it's relatively thin in nature. It is very strong in nature, and this particular plate is made out of titanium. The two types of materials that plates and screws are made out of are either titanium or stainless steel, most frequently. So this is the lateral side of the elbow, and then here is, again, the last part I'll just show is this is the olecranon, or the back of the elbow, and these plates tend to fit on the back of your elbow like that in case you break something like that. That kind of summarizes the stuff that we talked about today. We kind of showed you some plates and screws for the fingers and the hand, as well as the wrist and the elbow. And I hope that gave you a reference, a context, so that if you ever look at these films or something happens, refer back to this so that you can get a true sense of what's going inside and how it's being used to fix your fracture.